My name is Sean FitzGerald, and I'm speaking to you today from Jasper, Alberta. I'd like to begin today's meeting by acknowledging that the College of Physiotherapists offices are located on Treaty 6 territory, as well as the Métis Nation of Alberta's Region 4, which has been and continues to be the home of many Indigenous peoples since time immemorial. The College of Physiotherapists of Alberta recognizes that Indigenous peoples have been helping many live healthy lives on this land long before settlers arrived. With that, we commit ourselves to helping move people forward in their journey towards a good life and doing so in a way that follows the spirit and intent of treaty, that of peace, friendship, and understanding. We also recognize that people from across Alberta and beyond are joining us today and encourage you to take a few moments to learn more about the lands, peoples, and treaties with which you may be in relationship. It's my pleasure to introduce our three guests today, Michelle Valion, Dominique Bailey, and Preston Sloan. Dominique is currently a project control specialist with the Faculty of Health Studies at Northwest College. She was an instructional assistant with Northwest College's Physical Therapy Assistant Program, Interdisciplinary Therapy Assistant Program from 2015 until 2023. Dominique also served as the president of the Therapy Assistant Association of Alberta from 2012 until 2014. Preston Sloan is a physiotherapist and the coordinator of Medicine Hat College's Occupational Therapy Assistant Physical Therapy Assistant Program. Preston is also an instructor in the therapy assistant programs at Medicine Hat College. Michelle Valion is a physiotherapist and chair of the Interdisciplinary Therapy Assistant Diploma Program, Faculty of Health Sciences at Northwest College in Edmonton. Michelle currently chairs the Canadian Occupational Therapy Assistant and Physiotherapy Assistant Educators Council, and she also has 10 years of clinical experience in private practice and acute care orthopedics. As you know, I'm Sean FitzGerald, currently practice advisor for the College of Physiotherapists of Alberta, and today I'll be hosting this discussion. Generally, the concept of this webinar has a bit more casual conversation about PTAs, their skill sets, and how they're integrated into the delivery of physiotherapy services. Hopefully, for those of you chosen to join us, you'll get valuable information on the ins and outs of working with PTAs effectively. All right, so let's take a look at the results. Okay, perfect. So out of the people that applied, most people seem that they're aware of the general roles and responsibilities of PTAs, which is great. The second poll, so let's see kind of how people scored on this. Okay, so on this one, select all that apply regarding PTAs. So 20% believe they're a regulated profession, 80% they're diploma trained, 30% chose that they have certificates, and 30% their education is standardized. Okay, so I think kind of this is great because we'll cover a lot of those topics today, and I think kind of we can, kind of educate people that are joining us today on, how that all works and everything going that way. All right, so let's start things off. So topic one is we'll discuss the curriculum and accreditation standards. And Michelle, you're gonna kick us off with that one. So basically the first question would be, what's the history of formal training programs for physiotherapist assistants?
Thanks, Sean. I just wanted to start by thanking everyone for joining us for this discussion and thank the College of Physiotherapy of Alberta for organizing it. We know from a 2019 OT PTA visioning project, and we've heard from clinicians and team leads that's what the poll is reflecting, that we need to support a better common understanding of TAs and their role in practice. So I think this is very appropriate. COPEC.ca, which is the site for the Canadian Occupational Therapist Assistant and Physical Therapy Assistant Educator Council, is a great start for more information on this topic. And that's where I found the following information when you asked about the history, because I haven't been around for all of it. In the early 1990s, we saw post-secondary OTA and PTA education develop independently with differing credentials regionally. Some specific to the discipline OTA or PTA, while others were combined OTA PTA programs. The first standards for the accreditation of therapy assistant programs were created in 2012. So most therapy assistant programs today are combined OTA PTA 2-year diploma programs. And so that answers some of those poll questions. So most of them are diploma programs and most of them are now combined. Now that has evolved over the years. So, you might have diverse therapy assistants working in the clinics with you, depending on, how long they've been in the field. I'm not aware of any remaining like single discipline, so PTA only programs. Programs are now accredited under the OTA PTA Education Accreditation Program, or EAP for short, which is overseen by PIAC. So that's the Physiotherapy Education Accreditation of Canada, and CAOT, which is the Canadian Association of Occupational Therapists. Some programs, such as the one that Dominique and I are part of at Northwest College in Edmonton, also include other disciplines. So we also do therapeutic recreation and speech language pathology. So that makes our program a little bit longer, but it provides the foundation for TAs to support the entire rehabilitation team. Now, an important note is that accreditation is not mandatory, but it's something that you should look for when hiring a trained TA, because it demonstrates that there's a consistent standard of entry-level training that has been acquired. We provided the link, and you should be able to access it in the resources of the OTA PTA EAP. So that's our accreditors. And so when you access that website, there is a list of accredited programs across provinces. Dominic and I were chatting yesterday, and she noticed that Ontario has like such a large number of programs, but fewer that are accredited. So I thought it was just worth mentioning that. So again, accreditation is not mandatory, and the government of Ontario has extensive, comprehensive process for accrediting colleges and their programs. So some of them sort of came out of our accreditation process because they have sort of another accreditation process that sits outside of the therapy assistant world. So there's some differences between provinces, and just to note that. But within Alberta, we don't have that sort of second layer. So you'll note that there's that most of our programs have gone through the accreditation process and really evaluate in terms of what it provides for quality and consistency of our programs. The process is really similar to the physiotherapy level accreditations. I've done a lot with the standards and a lot of work with our accreditors. And so, yeah, it's very similar to the PIAC one, but it's applied and adapted to the context of diploma programs. The standards, again, are similar in concept. And there's one standard that's really dedicated to the competencies being like the skills, the knowledge, the attitudes that need to be developed to work within, a therapy assistant world. So that programs can demonstrate that their graduates have those knowledge, skills, attitudes as outlined within the competency profiles of OTAs and PTAs.
So, Michelle, I just had a quick question then too to kind of follow up on that. So, really in the end, I guess, what do the accreditation and curriculum guidelines really mean for the physios that are actually working with the PTAs?
So it's important to remember who the TA is that you're working with. So again, how long have they been working there? Are they graduates from a diploma program, and is that diploma program accredited? So if they are, then it means that the information that we provide regarding what they're going to learn in the curriculum, what you can expect, is somewhat consistent across the board, across who you're getting from those programs, between Preston's program, our program, the other accredited programs in Alberta. You're going to have that consistency. Those competencies that are listed within the PTA profile are expected to have been acquired, assessed, trained for throughout the programs.
Dominique and Preston, anything you guys wanted to add to kind of Michelle's kind of run through of the accreditation process?
No, I think I'm good. I have one thought. Yeah, I think Michelle did a really good job, covering that history and what accreditation means. And I mean, what accreditation and having a student or hiring someone who has graduated from an accredited program, I think there is a little piece that some therapists are aware of and maybe some aren't, that if you take a student for a practicum from an accredited program, there are going to be some requirements of that practicum. And you might wonder, why is this college or, this institution asking, how many hours are they going to get in, like, supervised by OTA or by an OT? How many hours are they going to get supervised by a PT doing those specific tasks? And I mean, those questions don't come because we like to ask them. They come because it's an accreditation requirement for us to have specific hours in each discipline. And so those types of things and some of the complexities around us, practicums, taking a student and those hours and why we're so specific with them is because of the accreditation requirements that we have to follow.
Perfect. Thanks, Preston. Actually, so Preston, we'll come back to you. Kind of moving on to, I think, kind of just getting a general overview of what your programs entail. So I guess we'll start off. So really, like, for your PTAs that are in program, what do they learn as far as like foundational knowledge of kind of the conditions that physiotherapists commonly treat?
Yeah,
how much time do you actually spend on that? Yeah.
No, good question. Now, Michelle touched a little bit on the competency profile that each of the programs will follow that. I mean, there's topics within that profile like accountability, collection of client information, intervention, communication, organization of physiotherapy services, and then professional development. I mean, that's really big picture, high level topics. But if we get into more specifically your question about what topics are we teaching about conditions, well, certainly each program is going to have extensive coursework on anatomy and functional anatomy, biomechanics, regarding each different conditions, and each program has it organized differently, whether there's specific course on conditions that you might see, or maybe it's within a growth and development course or within an application course. But we'll look at signs and symptoms of different conditions, how it's diagnosed, typical treatments that might be used, and then looking at that condition over the course of a lifespan. I think it's pretty consistent for programs to look at the ICF, or the International Classification of Functioning, Disability, and Health, and looking at that framework, so that we're not looking at just the health condition, but we're looking at body functions and structures, the activities, the participation, and then how the environment and personal factors actually play into that. And I think that's one area where we do a really good job in the therapy world. I mean, physiotherapists, occupational therapists are no different than what we do here with the assistants, but we're really looking at the person as a whole and trying to help with their abilities. Getting into like specific, go ahead.
No, I was saying you're doing great.
Sure. All right. Well, getting into specific conditions, and maybe Michelle and Dominic can help me, if I miss some of the main ones, but we really look at conditions from, a musculoskeletal end, cardiorespiratory, neurological, touch a little bit on mental health. But, we're looking at your typical osteoarthritis, rheumatoid arthritis, strains and sprains, fractures, osteoporosis, diabetes, cardiorespiratory type conditions, COPD, asthma, pneumonia, pulmonary edema, cystic fibrosis, more neurological, traumatic brain injuries, looking at stroke, spinal cord injuries, cerebral palsy, MS, ALS, Parkinson's. I mean, we could go list quite a few, but I mean, I'm sure with those conditions, you're like, okay, they're covering lots of the main conditions that a rehab professional might see. And then, I mean, we spend some time in mental health, but obviously we aren't mental health experts per se, but it's certainly part of our curriculums where we can see that part of a patient's well-being.
Yeah, and then I think kind of on that topic, I guess kind of when you're looking at, the PTA has a good general background knowledge of a lot of the things that obviously the patient conditions that they'll be dealing with. And then as far as doing standardized measures, do they know theory, practical knowledge, training, as far as you get to that skill set? Yeah.
Yeah, I mean, so when I was thinking about this topic, our therapist assistants learn a lot of the norms of things like vital signs. So what's normal, like heart rate, blood pressure, breathing rate, those types of things. And then also being able to measure those things practically. Things like range of motion, what are the norms, manual muscle testing, and then also how to do those types of practices manually. We look at outcome measures, so we try to cover really common outcome measures within the rehab field. So maybe things like the timed up and go or 6-minute walk test, maybe Berg balance scale, other types of self-report type measures, and have them become familiar with those. And not just familiar with specifics, but just what outcome measures are used for and how they can be, how they can provide value within a clinical setting. And then all of our programs, they focus on patient, patient mobility, patient handling. So, bed mobility, transfers, ambulation, those types of things, some theories behind how we do things, and definitely the practical side of it as well.
And then with, I guess kind of obviously too, it sounds like, with the background knowledge they have, and then as well as some of the theoretical knowledge and practical skills that they're learning, a big part of PTAs, at least from a lot of the therapists that I speak with, is, they do seems like quite a good job of like alerting PTs when there is like changes in a patient's condition. So patient monitoring, like part of program that you guys like teach, or is it more so kind of, an inherent skill set that they'll pick up on their placements?
Well, it's certainly something that we focus on, because it is such an important part for the TA, because the TA is often the one that is maybe spending more time with the patient than maybe the therapist, even in some situations. And so we focus a lot on observation skills just in general, and then specific to different skills or different practices. One example would be looking for signs of respiratory distress, looking for, signs that maybe an exercise that was prescribed is too easy or too hard, looking at cheating, methods or things like that. Those are the types of things that we talk with and practice with our students. And I think that adds a lot of value versus having, someone who may be untrained.
Yeah. And then I guess kind of thinking about just, that kind of patient interaction from start to finish. So consent wise, like, do you guys spend quite a bit of time kind of discussing like, how to obtain a consent, how to kind of, recognize kind of when or where kind of it's indicated?
Yeah, for sure. I mean, this is a really big part of our education, especially initially with our students, is just understanding some of those general concepts within healthcare, like, ethics, professionalism, confidentiality, and then, consent is one of those. And we talk about kind of the interaction of that where, let's say a physiotherapist has been in to see someone, they do an assessment and they say, well, I'm going to have the therapist assistant carry out this exercise program or help you walk, twice a day or something like that. Well, we communicate with our students that although that initial assessment and maybe consent for that has been done by the therapist, there still is a consent that needs to be gained by that therapist assistant going in the room, explaining what they're going to do, what they were assigned to do, and then, asking for questions, those types of things that we all know about consent, and making sure that they are covering that as well, and not just expecting that that's covered under what the physiotherapist has done.
Yeah, I guess kind of this will go to the group, like, obviously Preston and I kind of chatted a little bit about kind of what that program entails. Is there parts of the program that, we kind of haven't hit on, Dominique or Michelle?
The only thing I wanted to add was some of the courses that I think we have at least one course that touches on pediatrics as well with our particular program. So they are kind of a specialized population. We are, I think, trying to increase that a little bit. Michelle can maybe speak to that, but I think that was one population that wasn't mentioned. And we had a lot of students actually that were interested in pediatrics. And so I think we addressed that need and that want by trying to add a little bit more in there too. And in terms of consent, I smiled a little bit when we talked about it before, because it's something we hammer into our students from the beginning, just because what does that mean, right? Just saying, is this okay? It does not, is not informed consent. And really though it's a skill, I'm so my dog.
We were talking about this earlier, right? These unexpected things that pop up while you're trying to do stuff from home.
That's funny. Sorry, she saw something out the window. So for consent, I completely lost my train of thought. I'm sorry.
That's okay. You were talking about because when we were talking about consent, I did see you kind of throw a little smile up, so I wasn't sure kind of something what popped into your brain at that stage. But
it's just interesting because it's not a skill. You can practice it as you go along in your career and you start to work with more and more clients. But the way that we require students to, ask for consent and explain what you're doing and the possible risks and ask if they have questions, right? That's definitely a skill that needs practice. And we start from, I think, the first lab, the first class, and go up until the end of the 2 years to really develop that skill.
Yeah. Michelle, did you have anything else to add?
I was just going to add, to the consent, and I'll segue into something else. The part of that consent from the therapy assistant perspective is that it's important for them to also introduce themselves and identify themselves as therapy assistants consistently. So that the client can know who they're working with, right? Like, I'm not another physiotherapist, I'm a therapy assistant. And so that's part of the consent. And sometimes there's follow-up questions on that. And they, again, are trying to, be able to advocate and explain who they are and what the differences are between them and the physiotherapist. But I thought perhaps it would be helpful to walk through an example, thinking of the questions that I've had in the past from therapists and really understanding how therapy assistants work and are integrated, and how, the word competency is so abstract, I think, to clinicians and to, again, to our students, to most people. So I thought I'd walk you through just a simple example of, let's say imagine a client coming into a private PT clinic for an MCL sprain. The TA would, might potentially welcome them in the clinic, get them set up, see how they are that day, how they're doing with their home program, if they've had any changes. So in other words, they gather sort of a subjective update. You were asking about, reporting back and flagging things. So they can flag unexpected changes, consult with the physiotherapist if they have any concerns before they proceed any further. They can also take subjective measures, right? So Preston mentioned, range of motion, manual muscle testing, right? They could measure the knee flexion. They could test the quad strength, see how that's progressed. They can then perform the interventions that have been assigned. So they could do an ultrasound with the prescribed parameters. While they're doing that, they would be noting and watching for any adverse reactions, and again, reporting those back and documenting. They could be, setting up a client on the bike. They could be reviewing the exercise handout, grading a handout if one hasn't been created. They can correct, let's say, part of the exercise is a squat. They can correct the alignment, the performance. They can report back if the exercise appears too easy, too hard. If the therapists have given them that leeway or that guidance, they can adjust the exercise within the boundaries that the therapist has provided them. So they have enough depth of knowledge to not only do as assigned, but also recognized when a boundary has been touched or exceeded, or when, further follow-up is needed, either because a progression is not happening or progression has occurred. That maybe makes it sound like, then what's the therapist going to do? There's still lots to do. And obviously, depending on, the funding model of the patient that you're saying, there's lots of factors that are going to determine the balance of how much the therapy assistants can take on. The complexity of the client as well, how rapidly they're changing. But again, the funding model is another factor to be considered, especially in private practice. In contrast, in an in-person setting, the therapy assistant might go on their own in a client's room, also take a subjective update, check in, report back as needed. Preston mentioned, monitoring vitals, being able to, measure them, but also knowing the boundaries. of what's safe and appropriate. They could complete a functional outcome measure with a patient, run them through some bed exercises, adjust the gait aid perhaps that's been given out on the go. They could go for a walk, and definitely, again, document the intervention as well. So I was just hoping that an example would help put all that into a practical clinical context.
Yeah, which kind of I think leads us into kind of our next topic is what does this actually look like in practice? So I guess we'll kind of slide over to Dominique. So, seems like, I think I knew this already, but yeah, like, can you outline, I guess, the basic like sectors and patient populations that PTAs are involved with? I mean, you already mentioned pediatrics as something that's, you run a specific class with in your program. So, I'm guessing from cradle to grave is kind of actually one of the top terms that people use. Like, is that kind of pretty accurate for PTAs?
Yes, when I was looking at this question, I was pondering, and I spoke with Michelle yesterday, and we're like, I wish I could narrow that down, but I really can't. Like, therapy assistants really mostly work in any areas that there will be physiotherapy, except perhaps like the more specialized areas, like pelvic floor therapy, for example. But, we see our graduates in a lot of acute care, a lot of long-term care, continuing care. Schools have opened up a lot for us in the last few years, mostly because of the OTA component of our program and the SLPA component. Of course, private practice. I find with private practice, a lot of the students, if they have a good first practicum in our program, is usually in private practice. They might actually get hired onto that site, and then they stay with them while they're finishing their schooling. There's some really good private practice clinics that fully utilize therapy assistants to full scope, and so those tend to retain therapy assistants perhaps after graduation. So it's kind of runs the gamut. It goes everywhere. And in terms of population, it can be any of the populations that Preston was mentioning in the second topic, really. Yeah.
And then I guess kind of, obviously, between the three of you guys keep in contact, I'm sure, kind of with some of your students after graduation. So, and even after placement. So what has the feedback been? You kind of talked about like some, students having better placements when they're, full kind of skill sets being utilized. So I guess kind of how could PTs kind of use those skill sets a bit more effectively, whether it's even on placement or after PTA students graduate and enter the workforce?
Yeah, I was trying to also think about how to discuss this. I think that you have to consider the therapy assistant and where they are, obviously, in their career journey as well, right? If they're a brand new student, they're on their first, second, third practicum, of course, though they've learned many skills, they don't have a full rounded set yet. And so they would require more of that, perhaps not one-on-one, but maybe they're working together with a therapist for a while or another TA. I think the gradual kind of utilization of their skills is important, and knowing where they are in their journey is also key. And assuming or expecting that they would be growing within those skill sets and that knowledge as they go. And then it's not just about prescribing or assigning something, a task, and then off they go. We really teach our students from the get-go to ask questions and figure out, understand why something is being assigned, because then they can be more effective in reporting back and monitoring all those things. But of course, we say those things and we practice that at school, but that takes a while to get used to doing that. And so really connecting with your therapy assistant and figuring out where they are in their learning journey. If they've graduated, they should have kind of the general scope of what we've been talking about. But then really working with them to see what they can do and understanding that they can do more than just the assigned task, right? The monitoring, the reporting, the documenting, all those things as well. Yeah.
So I guess kind of from your, experience, and Michelle and Preston, you can kind of chime in on this too. So do you find like a lot of your PTAs kind of do play a bit of a self-advocacy role for what their role is within kind of the workplace setting? Like, do they do a lot of, talking to the physio and the OT and the people that they are working with to try and kind of, do they find they have to spend a lot of time trying to explain to PTs kind of what they can actually do?
That's an interesting question. I think it might depend on a personality thing and who they're working with, to be honest. I think that it also might depend on how long the therapist they've been working with has been working for, because sometimes the expectations might be different. I think there is a certain level of advocacy that happens, but it would be very dependent on the place, the timing too, of course. Like now, in the middle of a patient treatment is not the time to be advocating for those things. But I used to do that a lot with my team, but a lot of that came from trust and comfort and knowing each other and knowing they understood that I knew what I was, talking about and was asking for more. But not everybody's open to doing that in terms of assistance too, right? Some are very comfortable with doing what they've been told to start with, and then they might kind of build up as they get more comfortable and advocate a little bit more for what they know they can do.
And so I guess kind of like for, I guess as a PT, I guess kind of the, we've been talking, I think, about a little bit of scope of practice. So is this kind of in the, I guess the resources that we've kind of supplied, is they're listed, like that's in the PTA competencies, right? Would be kind of ideally like these are all the things that the PTA can do. Like that would be kind of listed in that resource that I think we provided, correct? Kind of where people like as PTs, like we can go access that and be like, okay, like, I heard Dominique talking about these are all the things they can do. Preston kind of outlined like these are all the things they learn in the program. And then, moving forward from this conversation, the PT could go back into kind of your program's competencies to kind of really learn and check box off like, oh yeah, they can do this, they can do this. Is that, would that be where a PT would find that information, is in your competencies?
I think that's a good place to start. I do think that competencies are a bit loosey-goosey and they're hard to conceptualize clinically. Again,
right.
We'll usually send out a checklist of skills to just sort of, again, give a best list that we can think of things that you could get your therapy assistant to do, but it's not a comprehensive list. It might be easier to think about the reverse, which is what can't they do, because it's really about scope. So whatever is in the scope of the physiotherapist, in that restricted scope, that's what they can't do. Everything else, anyone could do because it's not built into anyone's scope. So for example, they can't do spinal manipulations. For example, they can't, insert anything into the human body. But they can do, they might not have learned something in school, but it doesn't mean that they can't be allowed to do it. It might just mean that it's something that's not as commonly assigned to a therapy assistant. We only have so much time with our students. And so we can only contain so much. And we try to focus on the essential, the critical, the hard to learn, the most common, the day-to-day. For example, a lot of students will learn about taping. Not students, but graduates, but sometimes students will learn about taping. It's not restricted. We don't, really teach it enough for them to use it. But it's a great skill to expand on. Soft tissue techniques, not restricted, but we don't have enough time to do a full course on, working with soft tissues. So there's so many opportunities to expand beyond the list that, we might provide in terms of here's what's in our courses. But I think going back to what Dominique was saying and sort of optimizing TAs and how do you retain them and how do you, use them to their, to their best, having that intent, that intentionality of developing the therapy assistant, right? So you're in that position where you do have more expertise than they do, and sharing that background knowledge of like, oh, here's the patient. I'm not only going to assign you to do these interventions, but I'm going to tell you a little bit about them. And I'm going to help you understand why I've selected these treatment interventions. And then where I'm hoping to go with them. Here's our treatment goals. Here's a little bit about their background so that you can build a stronger therapeutic relationship with them, because maybe you're spending more time with them. Here are some treatments that I'm doing with them that maybe you're not familiar with, but I'll have you observe me while I do the soft tissue technique with them. And then we'll practice it together once on our own. And then you can do it with them next time. So keeping their growth in mind, I think, is really valuable.
Yeah, I would say from college perspective, like legislation for sure is a big part of that, right? Restricted activities. And then, like any, I think, thing, and you guys have touched on this before, like obviously you need to look at the skills and knowledge of that PTA that you have in front of you, what can they safely provide that's going to, obviously ensure, quality, effective, competent care. And from us at the college, when we look at, the PTA role, I think it really is come down to I mean, we talk about competency a lot, because it really is like, do they have that ability? And it's not always the technical skills too, but it's those non-technical skills that the PTA may have, which does, obviously make a big difference in patient care. And then again, looking back at, like you said, like program can only teach so much, so there is in some of these things potentially like no formal training. Not that they can or can't do it according to legislation, but there may not be time to kind of fit all of these treatment techniques kind of within your program. So as a physio, I think we would also need to kind of look back and reflect on how did that PTA learn that skill set, and then I think again, like does the PT have kind of the ability to kind of effectively teach kind of that skill set to the PTA. And I think too kind of comes down to I think PTA and PT both being, I think, self-reflective and the model of care, how does this kind of work in within, the system we work in, whether it's private, public, school-based, geriatric, pediatric. There's always those, I think, considerations that, PT has to kind of keep in mind. I think kind of the last question I'll ask to kind of, I think, on this more kind of topic is, I guess, and I'll give each of you a chance to answer. So, based on what you've seen and heard kind of throughout your, career, kind of working with PTAs and being involved in, the educational programs, is there like a big misconception that you think kind of exists around PTAs? And is it something that we've maybe already even touched on so far in our conversation today?
I think that we've touched on it a little bit. I would say from when I was working and as I started this educational journey, I think that it's really thinking that TAs only do what's assigned. I've given you your tasks, then go ahead and do those tasks. And perhaps the doubt or the misunderstanding that they can't use those critical thinking skills, they're not the same as the physios. Obviously, they don't have that assessment background. They don't necessarily have as in-depth knowledge of whatever condition the client might have, but they certainly are able to, really look at that client and say, that's not looking quite right. Let's monitor something. Let's try something. Let's ask some questions. Let's dive into what's happening a little bit more, and then more effectively reporting back to the therapist so that, we can really give that excellent client care. I think that that's probably, from my experience, was the biggest misconception.
Perfect. Preston, Michelle, any things to add or any summative comments?
This isn't necessarily a misconception by physiotherapists, but I think one misconception, one thing that we keep very clear is that like PTAs can't work independently. So that doesn't mean they can't work, by themselves for a period of time or have indirect supervision, but PTAs have to be supervised and be under the direction of a physiotherapist, whether that's direct supervision or indirect supervision. And so sometimes we get students come in or prospective students that we're talking to, and we make that very clear that, if you're an OTA, PTA, or a PTA, you're working under the direction of a physiotherapist, and you can't be independent outside of that.
Michelle, we'll give you a chance to jump in if there's anything you want to add.
Preston, I think you read my mind. The importance is that, and I don't know if we answered that, that poll question, but therapy assistants are not regulated. Because I was just thinking about it. I was like, I don't think we actually answered that. They're not regulated. They need to be under supervision of a therapist. You can't be a therapist or therapy assistant if you don't have a therapist. But that is not commonly a misconception by physiotherapists or any other therapists in the rehab team, as sometimes that's a misconception from managers that might not have worked in the field and that are, again, to their best efforts, trying to provide care to clients, and just sort of understanding those dynamics is important.
Okay, so we're gonna poll questions. So do you think kind of what we'll do is, as the poll questions come out, we'll kind of keep chatting a little bit kind of in the background. So the first question is basically a yes or no. So can a PTA be asked to perform goniometry? So as the audience has a chance to answer that one, we'll kind of, like I said, go through kind of the next topic, which is from your perspective. So what does a PT need to keep in mind when working with a PTA? So Michelle will give you a chance to kind of answer that one. And again, like I think in the bulk of the conversation, we've covered a lot of ground. So yeah, if you just need to summarize some of the stuff we've already talked about, I think it's, still appropriate to do so.
I think, as you're saying, we've covered the top important points, just understanding what they could do and keeping in mind what they can't do, understanding that there is possibility to continue to help them grow and develop. I really strongly believe that the really most effective way to work with a therapy assistant, and that probably expands to really working with anyone on your team, is to normalize that open, two-way feedback communication and build that trust. I've had the really huge pleasure of working with Dominique, really early on throughout our both iterations of our program, and that's something that we had built so strongly, and I think that that's how we've gotten to do so much together. And so asking, right? How did that go for you? Do you need to know anything more to be able to support this patient? Is there anything you'd like to learn? And then also fostering that in the TA and normalizing them asking and giving, again, feedback like, oh, that wasn't clear for me. So I think that applies across the board to any relationship in an interprofessional team. But I think really strongly, it's so critical to the therapy assistant relationship.
Yeah, I really would agree with that. And I think when we look at just generally, like, if, when you're dealing with, any, like, whether it's PT student or PTA student or, PTA or PT intern, like having like a very open, I think, transparent kind of relationship where you create an environment where they can ask questions and, and you have hopefully the time and the ability to kind of answer them and provide feedback. Because I do think kind of, most people in the healthcare industry, like, they want to provide good client-centered care. And, part of that, I think, is being able to kind of, grow your skill sets and kind of feel like you're kind of doing a good job kind of with the skill sets and within the role that you have. So I really do think kind of, those relationship things are key components. Preston, Dominique, what are your thoughts?
I was just going to say,
any other kind of things like PT should focus on?
I always use the word investment. Like, your PTA is an investment, like, and what you put in, like, and Michelle's covered it well, so I don't need to go over it in a lot of detail, but like, they're investments. So if you put time into them, and they're going to pay you dividends, and they're going to make your life easier. They're going to make things more efficient. There's lots of different goals around having a PTA in your clinic or at your site or at your institution, whatever it may be. Maybe it's increase patient care or improve it. Maybe it's being able to see more patients in one day. Maybe it's being able to decrease the workload of an overworked physiotherapist or other members on the team. And so regardless of what your goal is, and it's probably a combination of those things, investing in your therapist assistant will help you reach those goals. And I tell different fieldwork supervisors all the time, or people who've hired our students, they say, oh, I wish my TA could do this. And, outside of restricted activities, I say, well, then just take the time and teach them, and then they'll be able to do that for the next however many years. And so, that's all I have to add to that question.
I love that so much. I've never heard that before, Preston. I really, I really like that, because I feel like therapy assistants, like Michelle and Preston said, cannot work on their own, right? And so they are taught that, it's reinforced that, of course, they need to be working with a therapist. There's no option there. But if the therapist doesn't have the time, and I understand everyone is so busy with work, but if you don't put that investment in that relationship, it makes it quite a bit more difficult to do work effectively and provide and meet all those possible goals that you listed. So I really like that perspective. I'm going to keep that in mind when I'm teaching.
Okay, so we're going to take a quick peek at the poll result that we did have. So we asked can a PTA be asked to do goniometry, and the vast majority of people indicate yes. And is that true? I think we already talked about it, but yeah, right? PTAs can do goniometry. Okay, so the next one's going to be a little bit more of a, I would say, is this a good idea kind of question. So can a PTA perform an intervention that they are proficient with, but the physiotherapist isn't? So I guess kind of potentially this in practice. Have you had PTAs who've reported back to you kind of with this as a potential issue in clinical practice? I mean, I have had, I think, kind of an experience. So I guess we have PTAs in a private practice. They kind of used and applied kind of modalities before, and there's lots of new modalities coming out, and potentially they're using shockwave in a clinic, but the PT who comes in has never taken a course. They don't know kind of maybe the potential application, kind of the settings, all those things, contraindications, precautions. So generally kind of, this is kind of, I guess, leaning more towards the mistakes sometimes that occur in clinical practice. So I mean, I think kind of, as people kind of answer this, I think kind of we'll hint at the answer, which is, obviously the PT can only assign tasks that they themselves are competent in. And so obviously if a PT lacks competency, they can assign that task to the PTA, even if the PTA, has, done that task, 100 times, it's still something that's outside the PT's ability to supervise properly. So I guess kind of this leads into another question, which is, do you guys have an example that you've heard of where PTAs have maybe been a little bit misused or underutilized, given assignments that are not fitting for their skill sets or, their competencies? And I guess kind of we'll leave it open, so whoever wants to jump in first with kind of an example or something that they've seen in clinical practice.
I think you've given away the answer to this poll.
I did give away the answer, right?
So
let's see.
But I think the more important answer to the question is, well, then what do you do, right? So let's say the PTA is like, so I can apply shockwave therapy. That was a good example, actually. Well, then what should you do? It sounds like a good idea to apply it to the patient. It sounds like best care, but I don't know how to do it as a therapist. Well, it doesn't mean that the education and support and investment, again, I like that word, can't go both ways. So the therapy assistant could share, when did they learn about shockwave therapy? How would they apply it? Taping would be another example. Maybe, another therapist that they worked with supported them to go to a kinesiotape course, and they learned how to do it. And the therapy assistant suggests to the therapist, hey, the client was asking about it. I think it's a good idea. Could we add it to their treatment plan? And then the therapist should go, well, I don't know anything about kinesiotape. Then, here's my notes about it. Here's a resource. Read it. Can you show me how you would apply it? And once they have a sufficient understanding of the application and purpose and rationale to apply it, then the therapy assistant could still be more proficient at it than they are. But as long as they have, built up their understanding to a level where they're making a critical decision for the rationale of it, and they're able to oversee that it is done properly. I remember one time I was in acute care orthopedics, and the therapy assistant there, I was working casually. The therapy assistant there had years of experience, and the frame to do transfers much better than I ever could. And we were trying to do something together, and he's like, "Can I just do it? And I'm going to use this thing, and I've done it lots of time, and you can, watch me do it, and maybe we can do it together." And he did it, and it was like a snap. And so I really appreciated him stepping in and showing me how he did it, because it was much better than what I was trying to do. So I think that, again, that relationship and the trust that you build, trusting other therapists that have worked with that therapy assistant, and building your own skills, and trusting that the therapy assistant will help you build those skills as well.
Yeah, I think kind of there's obviously, I think, within good working relationships, there's obviously a back and forth of kind of discussions, and, you can generate ideas together and things like that. And I think kind of for us, I guess kind of, yeah, from the college standpoint, like that is a bit of a fine line too, trying to walk like as, okay, well, again, like recognize the PTA may have a skill set that you haven't kind of gathered yet as a PT. And it kind of really comes down to as a PT in the end, like you can only assign those tasks that you're competent to kind of supervise. Because if I don't know that tape job, or if I don't know that transfer skill, like I can't really appropriately see whether or not that's being done correctly, right? You can look at it and be like, you understand the biomechanics, you understand kind of how this would work theoretically. But yeah, I do think at the end of the day, for, from the college perspective, it really does come down to, what does the PT know, and what does what the PT doesn't know. And really, again, kind of the, if you don't know, and I guess kind of at the same time, yeah, doing your due diligence as a PT in order to kind of gain those competencies if you do see a gap in your knowledge when you start a new place of work. Because obviously PTs, we move around the workplace, and when we start a new area of practice, the expectation is that it's going to take time to build those competencies, and you want to source knowledge from as many kind of different places that you can to get a better understanding of what that new workplace skill set is needed. Okay, so let's take a look at, we pushed the last one out. So the last kind of poll is, can a PTA remove acupuncture needles for the physiotherapist? So I will say we've had this question come into the college before. So we'll give the audience a chance to answer this and see kind of where they land. I think kind of while we do this, and we have had some questions come in from the audience, and we are kind of at 8:55. So we'll kind of slide into those questions kind of first. So one of the questions came in, like, whether a physiotherapist's approach towards a kinesiologist is exactly the same as any other support person, such as a PTA. And I guess kind of, Preston will give you a chance to answer this one first. So if I was a PT, yeah, what is, I guess, kind of the approach difference kind of between a kin and, say, a PTA?
Yeah, that's a good question, and I might not be the best one to answer, but I'll start with a few thoughts. I think with the PTA, you have a good idea. I mean, we've talked a lot about it in this conversation already, of what skill set they have and what they don't have. Whereas a kinesiologist, as a physiotherapist in a orthopedic setting, I had a student that was a kinesiologist come in, and to be honest, it was a lot of guesswork on what they actually had knowledge in or not around. I mean, we knew they had anatomy and physiology, and then aside from that, in a kinesiology degree, and maybe I'm just speaking more specifically to my experience, there was a lot of things that I expected that they would know that they didn't. And then on the flip side, there's a lot of things that they knew that I didn't know that they would. And so for me, I think with a kinesiologist, just seeing and investigating more of what that what their education did entail with their options and this and that. There were some really basic physiotherapy clinical skills that the kinesiologists didn't have, that are just base for our TAs that we train. And so that was a surprise to me, and something that's always stuck with me. Maybe that'll start the conversation.
Dominique, do you want to jump in? Or Michelle? Yeah.
Okay. I'll go ahead. That is a question that I've often gotten, when setting up new practicum sites, because some sites will have had maybe kinesiology students or have a kinesiologist as part of their team, and then they're hesitant in terms of where would the therapy assistant fit in. And sometimes the kinesiologist plays the same role as a therapy assistant. I think it goes back to, what do they know? What are they competent with? The boundaries would be the same in a sense that you can't assign them this box that is only within the scope of physiotherapists, but everything else is okay to assign as long as you've assessed that they are competent in those skills. And what they're competent in as a kinesiologist might be different than what a therapy assistant is competent in. My assumption would be that their knowledge of functional anatomy, exercise physiology, and general exercises would be stronger than a therapy assistant's based on their background. But that's not necessarily true if you have a therapy assistant who's grown their exercise skills. I wouldn't necessarily assume that they have a strong background in, rehabilitation framework and sort of the ethics and boundaries within the scope of working and assisting with a physiotherapist. But again, that might not be true because that kinesiologist might have taken some different courses, expanded their knowledge of rehabilitation. So I think it goes back to the open two-way communication, assessing competencies, and determining what do they know and where's the gap.
Yeah, I'll just jump in. And I think kind of you touched on, I think, a really good point is, for PTs that are working with supervisees, whether they're, PTAs, KINs, people that have been trained on the job, every PT needs to kind of assess and evaluate like what that support worker's competencies are first before you do anything with them. I think the one thing I will touch on with kinesiologists is there are times where KINs are working independently, which is a different kind of role than PTAs. And not that it, again, when we look at it within AHS, there are some KINs that are just employed as kinesiologists. They're not working under the supervision of anybody. And again, within private practice settings, you might have a kinesiologist that, again, isn't working as a support worker. They're working as kind of their own kind of person prescribing exercise and working within the skill sets and competencies they have. But yeah, I really like the fact that you touched on the fact that, you don't know kind of what that PTA or KIN is capable of doing until you actually sit down with them and have those conversations and kind of get an idea of what have you learned. And the PTA programming has, I think, obviously a very standardized, this is what we take our students through, this is kind of what we focus on. So there is, I think, a bit of a different expectation kind of definitely, I think, between the two. Dominique, did you have anything you wanted to add to that one?
I don't think so. I haven't worked with kinesiologists at all.
I guess kind of we're going to do the last poll result. And so can PTAs remove acupuncture needles from the physiotherapist or for the physiotherapist? Okay, so I'll just say from the college, this is a definitive no. Anything to do with providing a restricted activity is part of that restricted activity. So removing acupuncture needles would be part of that restricted activity. So PTAs cannot be involved with putting in, removing, or anything revolved around acupuncture needles. And that would go with any restricted activities. They shouldn't be involved in the provision of any of the restricted activities, whether it's, tracheal suctioning, relocating a dislocated joint, the broad gamut of the restricted activities PTs can do. The PTA is not to be involved in any of those activities. So yes, that would be from the college and legislatively a hard no. Okay, so we do have some more questions from the audience. So we're just going to keep rolling. This kind of, I think, comes into, I think, bigger picture stuff of looking at, the evolution of PTAs, programming, legislation, regulation. So I guess kind of we'll start off with kind of the questions that are specific, but I think kind of we'll have a chance to kind of talk about it in broad terms. So, do you, as part of the PTA training institutions, think there would be a value in differentiating the support workers that have diplomas from accredited programs from the untrained support staff? And then what, and I guess I'll talk about the college's views on that, but I guess kind of from you guys, do you think there would be value in differentiating between those accredited programs and, people that are going through different channels to become support workers? And then I guess second to that was, do you really see, or how do you see the evolution of your program or the evolution of PTAs? Someone I think likened it to, looking at the evolution of LPNs. So I guess kind of I'll throw this out to the floor, and I think kind of whoever wants to step on this one first can start us off. Dominique, we haven't heard much from you, so we'll give you a chance to jump in.
I'm not sure about the differentiation between the therapy assistants that are diploma trained and those that are not. The only reason I say that is because there's a lot of therapy assistants that were trained on the job that have been working for a long time that have a lot of really important skills already. I think that it is here in Alberta anyways, I think it is becoming more standard for, job postings to be asking for a diploma from an accredited institution. So that, that comes down to the employers side of things, really. I do think that there's value, of course, in hiring a therapy assistant that's been trained with one of our accredited programs, just because we do follow such a strict pathway and competencies and the learning and the practice and the expectations to keep increasing as they go through our program. So yeah, it's not I feel like all the questions I've answered are not like black and white. There's no like, yes, no.
Right? We keep lobbing these ones at you. Tell me, you take this one.
That's okay.
Yeah, and I think
go ahead.
Yeah, I was going to say, I think it's true though. I think kind of, in at least from, again, like coming from a more of a, I guess, a college standpoint is, because, the PTA program isn't, or PTAs aren't a regulated health profession, you kind of fall into, for us at the college, we kind of lump them in together with, the on-the-job trained, the KINs, the PTAs, the vast kind of majority of, the support workers that are out there working with physios have had quite a varied, background to how they kind of arrived in that profession. And I do think kind of, there would be, I think, quite a bit of challenges is to kind of how you would kind of make that change in differentiating the PTAs across. I think, when I think you have a PTA in your practice and you recognize, I think, some of the skill sets that they bring in straight from graduation, and I think potentially the reduced workload on the PT or the work site to kind of train, there is definitely, I think, some advantages to obviously kind of having somebody who's come out of one of your programs versus somebody that you're going to try and have to spend that time and energy you have a lot more capital investment in the people that are untrained versus kind of, the initial investment that you have with somebody who's gone through the diploma program. Michelle or Preston, do you guys have anything to kind of jump in on that one with?
I can add to part one, which was the supervision piece. I think the description leaves enough leeway to adjust to who you have in front of you and what you need to provide in terms of supervision, right? Is it direct, constant supervision, or can it progress to less constant, more indirect supervision in some cases? I do think that, from a human perspective, it might be nice as a therapy assistant that's trained from an accredited program to be sort of recognized in a different category when I look through that description. But ultimately, when you apply it from a practical perspective, I don't see that there would be a big difference. So that's a yes or no answer, kind of. Maybe yes, maybe no. The second question, though, I find really interesting. So I did my physiotherapy degree in Ottawa, and did some placements in Ottawa. And I'm from Gatineau, Quebec, so I worked in Quebec for the first part of my career. And in Quebec, we have technicians, which is a different level, and they are regulated. And so it's completely different than it is here. And so I can't remember exactly what the question was, but could we evolve to that? Well, that's basically what Quebec has, is they have a technician level. It's a 3-year program rather than a 2-year program. They are regulated within the college of, or the equivalent of the College of Physiotherapists in Quebec. So could there be value to that? So having worked with some of those technicians, yeah, there is. They have a different skill set. They're able to do some things that are here reserved to therapists. There's pros and cons, as always, to having those different levels and keeping those differences clear. You know, obviously, if you have technicians, you need to pay them more. There's more gray in terms of whose scope is this. There's potentially value because we know where our health system is at right now and the need for more rehab professionals. There's risks associated to it. And so again, it's sort of a yes and no answer. I think it's a worthwhile discussion, but I don't think that we have the answer or any clear plans to move or not move in that direction yet.
Mm-hmm. Which I guess kind of will go actually back to to Dominique a bit, because you were, I think, obviously past president of the, association, and you spent time, I think, kind of looking at some of these things. So I guess kind of going, do you, when you speak about that process of evolution and even kind of attaching more specifically to becoming regulated, I guess kind of, what are your thoughts on kind of that piece, Dominique?
Yeah, it's such an interesting dilemma, because from a therapy assistant working perspective, there was definitely a lot of the people that I spoke with that were in support of regulation. But I think that was coming from more of a place where you have a recognized title, there's a more recognized scope that is yours, as well as possibly being paid more. Like, those were really the reasons that a lot of the TAs that I spoke to wanted to be regulated. From a regulatory perspective, it's so complicated, and also considering the fact that we work interdisciplinary, I'm not sure what that would look like, because we would try to explain that to TAs that have that question, that if you're working as an OTA PTA, but then you're doing rec therapy that day or something, and something happens, or even if you're regulated under a PT college, I'm not sure what that would look like. Then are they paying fees for multiple colleges? Is there one college for all the disciplines? Like, it's such a complex environment that we are in currently that I'm not sure how that would move forward, honestly.
Yeah, and I guess kind of I'll jump in, and really kind of for it has nothing to do with I think us as a college itself, right? Like, this is, getting regulated is a huge legislative process that has to be undertaken by I guess the group that wants to become regulated. And right now there's a few professions that are kind of within Alberta waiting on getting regulated status, and it takes a long time. It's a lot of work, and then you do have to kind of look at those pros and cons. But yeah, it's not like you get to come talk to us and we're like, for sure we'll regulate you. Like, it's kind of one of those things that really it's such a big kind of thing that I'm glad you kind of were able to speak to it, Dominique, so thanks for that. Okay, so I think kind of we'll go back to, there was a few questions that have kind of rolled in around that, like direct, indirect supervision that's kind of come through. And I think I'll add my 2 cents is, obviously, that's the supervisors, direct and indirect are 2 appropriate methods of supervision, but really it's the supervisor who is able to kind of determine if that type of supervision is appropriate for the PTA. And so, the PTA makes a decision like, yeah, I've assessed your competencies, I've watched you do this, things look good, we can kind of now move to more indirect supervision. The PTA, has that, training and skill set to kind of identify, hopefully, like when, things have changed and when, all of a sudden they have a situation where they need to kind of then bring, the PT back in to kind of have that discussion. And this is something that obviously I think Preston touched at the start, is patient monitoring. Like, it's the skill set the PTAs have to kind of recognize, be like, ooh, like this is different. I think we need to kind of bring the PT back in to kind of reassess and kind of we'll come up with a new treatment plan. But when it comes to indirect supervision, we get this lots, whether it's PTAs, PT interns, PT students. Like it's a question I think a lot of PTs are unsure about. So generally, and you guys can chime in on this in a bit, is just for us, like you can move to indirect, and indirect means, potentially the PT might not be on site. Like they might be in a different part of the facility. They might be even, outside of that workplace, but the part of appropriate supervision is they're available for that support worker or that PTA to kind of get a hold of them if something does change, or they have something in place in which kind of, whether there's another PT that's kind of, been deemed like, yeah, if you have any questions, this is who you're going to talk to. Because obviously, like within AHS facilities and with, even with private practice, you have people are on different shift schedules. Sometimes kind of the PTA you normally work with might be out sick, and there's a new PTA that's kind of in there. You have to kind of, I think, kind of keep a lot of those different kind of aspects in mind when it comes to indirect supervision. But there's nothing wrong with indirect supervision. It's great, like that you can assign a task and you have a PTA that has the competence that you've evaluated and have the skill set that you can kind of carry out those tasks. But yeah, I think kind of PTs, I think, get a little bit, I think, not confused, but just unsure of themselves when it comes to that indirect supervision point. And I guess kind of I'll turn it over to you guys to kind of have a comment on, is that something you see commonly as well? Is that kind of confusion or kind of hesitancy with going from direct to indirect supervision?
I think you see this all the time in long-term cares. In a long-term care, you might have a therapist assistant and maybe more so an OT and an OTA, but I mean, the concept's the same. But, in long-term care, you might have a therapist assistant who works 4 or 5 days a week, almost 40 hours a week. And you might have a therapist that's contracted there or hired there for 1 day a week or 2 days a week. And that's the norm. And so obviously there is a lot of indirect supervision when it comes to that type of setting in most cases. And I mean, I've seen it and talked to people who work in those settings. And I mean, a lot of it is that communication piece. When the therapist isn't there on site, yeah, are they available, or who are they to contact? Is it the nurse, the RN that's on, is that where I need to go if there's an immediate concern about, patient well-being or something like that? And those types of things are, I mean, they happen, and it's efficient. It's efficient for that long-term care to hire the therapist assistant and therapist in that way, and the quality of care is able to be maintained at a high level.
Yeah, absolutely.
What came to mind for me was my time working in home care. So when I worked on the stroke early supported discharge team, so I'd say probably 90% of my time was spent in client homes by myself with them, but I had a phone that I needed to have with me, of course, and then I could call, my team leader, the physio or the OT, whoever was needed for whatever was happening. And then they had specific requirements. For example, the PT might observe me do a treatment every couple of months or so, just to make sure that, again, maintaining competency and that they're actually seeing, eyes on what I'm doing, and having that access. So it's funny when we're thinking about independent or supervision that's direct or indirect, right? It doesn't mean that I was still working under the supervision of a PT or an OT, but not necessarily in the same space, for sure.
Okay, just being mindful of time. We just have one more question we're going to get through. Is there education options. Audience about kind of, like PTs. So obviously we change practice sites. We, sometimes go from private practice to acute care settings. It's a big kind of change for a PT. PTAs obviously go through some of the same, I think, kind of like job changes. So is there continuing education courses that are out there for PTAs or refresher courses that they can kind of go back to kind of refresh kind of their skill sets?
Unfortunately, we don't, like, the volume of therapy assistants is not as big as the volume of therapists. And so there aren't as many TA level specific opportunities for continuing education. I know that, I can only speak for our program, that we do allow practicing TAs to take any of our courses in our program, so that they can, refresh a course, update it if it's been a few years. There's a lot of free resources out there, and often having the therapist that's supporting you sort of guide you through accessing some of those resources. There are some professional development providers that offer PT training that will allow therapy assistants to attend when the training's appropriate, sometimes just with the support of the therapist acknowledging that they will be, supervising them within that context. So that is an area that we need to grow more in and support therapy assistants better, is PD. But I strongly believe that if the therapist that is supervising them, that is on their team, is dedicated or invested in their development, it makes a huge difference, and it's definitely a possibility to find a good plan for them.
Okay. All right. So, I think we're kind of out of time for today. I'd like to obviously thank excuse me. I'd like to thank Michelle, Dominique, and Preston for their time.